This project is Increasing Patient Understanding and Satisfaction Through Improved Nurse-to-Patient Communication Using the Teachback Method by Azmeen Woolfolk. Introduction. Nurse-to-patient communication is an essential component within healthcare. More than one-third of all Americans lack sufficient health literacy. One of the most effective methods to improve patient education is the Teachback Method, Tamora List 2013. In over 3,000 Sentinel events reviewed by the Joint Commission, communication gaps were identified in 65 to 70% of the reported events, according to Adamski 2007, as cited in Tamora List 2013. Purpose. The purpose of this project is to enhance patient education through the Teachback Method to improve nurse-to-patient communication and patient satisfaction scores. Background. The project's needs. The overall composite score for nurse communication in April 2015 was 74.3%. The average score for nurse communication within the facility was 83.5%. The goals and aims of this project. The goals were to increase nurse communication to 80% and implement the Teachback Method when patient education is provided. The aims. The Institute of Medicine's aims that were identified are safety, effective, and patient-centered. Methods. Population, adult patients. Setting, 38-bed neurological telemetry unit. Tools. The Hospital Consumer Assessment of Healthcare Providers and Systems, and the Nurse Communication Score, and the Teachback Survey. For the HCAHPS survey is intended to provide a standardized instrument and data collection methodology for measuring patients' perspective on care provided while being hospitalized. Intervention. Education and implementation of the Teachback Method. Data collection. Teachback Method survey will be given via SurveyMonkey, and HCAHPS survey given to discharged patients from an outside company. Please note, the patients had to have been discharged from the neurological telemetry unit. Methods. RNs on the neurological telemetry unit were taught about the Teachback Method through role-playing during a 2-week period. RNs were randomly audited while providing patient education to determine if the Teachback Method was utilized. HCAHPS surveys were given to discharged patients. Pre- and post-implementation data was compared from April and May 2015. Data collection. For the Teachback Method survey, inclusion criterion, RNs employed on the neurological telemetry unit. Exclusion criterion, RNs from other units. Provided via SurveyMonkey. It was an anonymous involuntary survey given 4 weeks after implementation. The HCAHPS survey. Inclusion criteria was HCAHPS data from patients discharged from the neurological telemetry unit for the months of April and May 2015. Exclusion criteria, patients discharged from other units. Data collection continued. Teachback Method. There were 3 questions asked. When providing patient education, do you utilize the Teachback Method? Yes or no? What is the Teachback Method? Question number 2. Question number 3. What are barriers to utilizing the Teachback Method when providing patient education? Data collection for HCAHPS surveys. There are 3 questions rolled up into the composite score for RN communication. Question number 1. During this hospital stay, how often did nurses explain things in a way you could understand? Question number 2. During this hospital stay, how often did nurses listen carefully to you? Question number 3. During this hospital stay, how often did nurses treat you with courtesy and respect? And that came from a HCAHPS survey, no date. Results. The nurse communication composite score increased to 74.7% in May 2015 from 74.3% in April 2015. The components of the composite score from May 2015 compared to April 2015 are: nurses explain things understandably increased to 76% from 67.6%. Nurses listen carefully to you increased to 72% from 70.3%. And treated with courtesy and respect by nurses decreased to 76% from 85.7%. If you look on the right hand side of the screen, you will see how the results compared from April 2015 to May 2015 for those questions. Also, on the left hand side, those numbers are in percentages. Teachback survey results. There was a total N size of 11 RNs. 11 out of 11 RNs described what the teachback method was correctly. 90.91% of RNs stated they used the teachback method when providing patient education, and 9.09% stated they do not use the teachback method. Barriers to providing teachback education: hearing ability, language, cognition of patient, non-compliant patients, time constraints, extensive education, patients sleeping during night shift, and patient and family stressed or overwhelmed. Discussion. Results from the HCAHPS survey suggest patients understand nurses more after teachback was implemented. However, the data is not significant. The sample size was significantly smaller than prior months due to the unit relocating. Sample size was 24 in May of 2015 compared to 37 the prior month. The Teachback survey results showed that 10 out of 11 RNs utilized the Teachback method when providing patient education. However, there were many barriers to providing education. The most common barrier was time restraints. Future recommendations: completing pre and post data for Teachback survey to compare results, recreating project to see if the project can be generalized, increase the sample size, and trend data over period longer than 1 month. Thank you.